Hi, good morning.
Well, it's Friday, and you sound chipper as always. I know that you've got a lot of things going on with the GHRA,
Yes,
and
thanks for always including us.
yeah, and I'm not sure where we're gonna start here. Did we want to do this Guam Reef Hotel thing? It was brought up a couple days ago in a press conference. The governor didn't know about it, but it turns out that there is a small group of this 506 squadron that's on a self quarantine, similar to other people who come into Guam. You want to kind of clarify that for us?
Sure. At any time, we do have military active personnel, but also Department of Defense civilian workers who fly into Guam through Honolulu or other routes. And when they come into Guam, they are still subject to the mandatory quarantine as of last week, Thursday. So this is no different from any of our residents or tourists who fly in and are subject to this. The one difference here, though, is that they are on restricted movement, and Anderson Air Force Base is working to ensure that they go straight from hotel to work only because they are mission critical, but they are part of a deployed group of 150 people that have been staying at Guam Reef for 2 years. So it's important for everybody to understand that this is not related to the USS Roosevelt, and that at any one time, we actually have 13 hotels who are contracted with the military. So we have several hundreds, sometimes thousands at the hotels in short-term and long-term lodging.
Mm-hmm. Have you been part of the discussions for this economic relief plan that the governor's been discussing? And I know that the GHRA Deputy Director, Ricky Hernandez, he made a brief presentation during the media conference yesterday.
Yes, I've been part of 2 conversations so far, or groups. One was the Team Guam, where she presented her initial plan to the different business groups, and then the one where Ricky made a presentation. So yes, I've been part of both of those.
And what do you think of the plan there from Ricky Hernandez and the governor's fiscal strike team?
Well, just so you know, that's not the only thing being discussed. She is reaching out to specific business people so that we can also provide input on additional ideas of where we can add some, not just some strategic planning, but also some recommendations of what things we can offer. So it is a two-way communication, which I think is good, especially right now. I think that the more people who give input, and I think that she is open to it, especially now that we're on an extension. But, I even serve on the GVB task force for the coronavirus, and we provide a lot of economic forecasting information based on what we see in the next several months. And so I think that's going to be really important to tie all of those in.
Can you just tell us what is the economic forecast for the next several months?
Well, with the extension already, we were expected to be at 30%. And with this new extension, and with flights already suspending services through April, it's probably it's gone from 30% down to almost zero arrivals. And so obviously everybody's adjusting their numbers, and businesses, you will start hearing some businesses just temporarily close in the next couple weeks because there's no reason to operate unless they have the military or short, long-term tourists staying in the hotels, or even residents. There are some hotels who have zero traffic coming in at all because they're not part of the military contracts, and they have not been receiving any tourists. So I've already been notified by several that there are plans to temporarily shut down. I do know that there are 2 hotels looking at even closing doors permanently.
Can you tell us which hotels those are? Is one of them Verona?
Well, they've been closed for, I don't know if you consider that really open. But yes, I do know that I've already been notified by Royal Orchid that they closed a while ago. And so they are not looking to reopen at this time. I'm not sure if they're going to be selling, but they've confirmed that with me. And then also Holiday Resort in JMSH, which operates Garden Villa, they have also indicated that they won't, they're right now reconsidering that. So between those hotels, that's very key when you're having businesses already reconsider their entire operation.
Right. Mary, what can you tell us about layoffs? We haven't yet got any numbers about that, and just from the GHRA side.
Sure. We've been polling our group since January of what their plans are, but really heavily in the last 2 weeks. And we've actually shared some information. I know you were able to finally speak to Dave De La Sola, and we have shared some initial information. And our numbers, the industry does employ 20,000 people. We do make up 35% of the population. And at this time, our initial estimates are around 3,000 people have been affected with their jobs, whether it's reduction in hours, reduction in force or furloughs, and layoffs. So it's a mix of those. And I can't release the specific data because we're still collecting it and reporting it into DOL. We've already offered long time ago to be their partner for private sector to help navigate through the programs and share this with our membership. So right now it's about 3,000 people have been affected by this, but it's a mix of things, not all layoffs and furloughs.
Mary, how is the working relationship with you and the local Department of Labor and David De La Sola in terms of getting any answers or any type of assistance for these employees who have been affected by COVID-19?
I think that it's good in the fact that we do share information, and there are plans to work to provide these services. I did share with the Gov that I know she's very concerned about the public health. That is her number one priority, and she cannot reopen Guam Department of Labor or any of the other agencies. But I think it is important to have like a small go team, if you will, even working remotely, so that we could start sharing information at least electronically via email. But we're doing that on our part. I have one person who is focusing just on this with the employer groups and walking them through the DOL website and understanding some of the Workforce Investment Opportunities Act federal funding that's available today, but also starting the conversations about, as soon as the administrative protocols are set for the federal funds that just got approved with the Senate and Congress, then we'll make that information available as soon as it's ready for digestion from DOL, but also GHRA. And that was something Ricky did talk about yesterday, was they are currently trying to understand the different administrative protocols of how to get that federal funding for businesses and also to apply the different benefits like sick leave and things like that. So we're still waiting for direction, but in the meantime, we can at least educate our members while they're making decisions today. We can't wait for GovGuam to reopen, but we can certainly help provide guidance. And that's what's really key right now, is providing information to our membership, and not necessarily to the employees at this time, because that's really the role of DOL, but at least to the employer groups on how to make, when they're making their decisions, what do you need to do to keep individuals on the payroll, but you can still do something where they still have access to health insurance through COBRA. They still are at least legally defined in how they were going to be reduced in the fact that they will be eligible for federal benefits.
Mary, I wanted to ask and follow up on something that I watched during one of the Pentagon press briefings, when it was mentioned that the Army Corps of Engineers are going to be deployed and assisting in several parts of the country to convert hotels into, I guess, like mini hospital facilities or even quarantine and isolation facilities. Have you received any information on that, whether that's going to happen locally?
I have not. I know that probably in the case of, with regards to our buildings right now, I think that GHRA has really stepped up in working with the government of Guam, and we do have a direct contact where not just hotels, but also other types of facilities have been considered. And we started this process about a month ago. And so we've been able to successfully include some of these facilities to serve as not just mandatory quarantine for our Manila travelers, but also auxiliary hotels to provide self-quarantine for other types of travelers, or even residents. So I think that for quarantine facilities, we've been able to assist the government in providing alternative solutions instead of what the pandemic plan called for, which was the Dededo Sports Complex and UOG Fieldhouse. So I think we met our goal there, and they're still always looking for additional quarantine facilities. But then the second piece about converting rooms, I think it's important to note that the skilled nursing facility has capacity of, I believe, 58, and only 2 are there currently.
Right.
GMH has people there. The skilled nursing facility still has a lot of capacity. So I don't think we're there yet, but my concern is inside the fence with regards to the USS Roosevelt. They're going to have to convert some places inside the fence, and I think that would be their highest priority if the Army Corps of Engineers or the Seabees or whoever is on island, where that is their critical mission.
Mm-hmm. I wanted to follow up also on something that Linda and Bingo DeNorsi mentioned regarding an isolation facility at a hotel. Can you tell us anything about that?
The isolation facility right now, the way it's supposed to serve is similar to skilled nursing facilities, but the difference is that they are positive, but that their symptoms are mild. So instead of quarantining at home or isolating at home, because they don't want to run the risk of, because they are positive, they're not a PUI, person under investigation, they are positive. They need to be careful because they can't necessarily stay home, especially with elderly or now I guess anybody, because it doesn't matter. Our numbers aren't showing a higher percentage to just elderly. It's actually spread across the board. So there's been a need to not just have quarantine facilities, but also an isolation facility, just because of our dense areas in some villages, but also just you don't want to run the risk of having more positives out in the community.
Right. And so wherever this isolation facility, hotel, what efforts are underway to ensure that the employees that work there are protected from exposure?
We have been very clear from the beginning that we want little to almost no exposure. If the government of Guam, through their mandate, is going to have access to the facility, everything that we've been stressing is that the government either takes over the building and still has certain things functioning, like engineering, back of the house operations for maintenance of the building, but little to no access with front desk and housekeeping. But as we've gone through this the last week and a half in quarantine, it is pretty clear that we need to still provide some back of the house operations and support services, because at this time there's only so many resources that we have. But I think it's been helpful that GPD has been augmented now with the National Guard, but and that public health, they have a really core team that they've been working with, and they've been really great in coordinating services with the hotels in making sure that public health is taking the lead on any front of the house services. So I think that has improved as we've all been kind of learning through this. I think that public health has done a great job in trying to close the gaps on some of the things initially that we've been going through.
Just an update. So there's still 3 quarantine facilities, is that correct? Hotels?
There's a 4th one.
Is the 4th one the isolation facility, or 4 quarantine facilities and 1 isolation facility?
I believe, I can't really comment to that because they are under contract negotiations, and we are not releasing where these are. I know that there's been some coverage on where these locations are at, but that's going to have to come from legal counsel with the government. But I can say that though we did add a 4th and a larger one, so that way the government has some room to move around should they need to create more isolation facilities.
So, isolation or quarantine?
Both.
Okay, so 4 quarantine, 1 isolation? Because when we talked to Linda, she mentioned there were 3 quarantine facilities and then 1 isolation facility.
Right. So basically, we've converted one into. We've consolidated people into a quarantine facility.
Okay.
And one of the smaller ones has become
The isolation.
facility.
Okay.
Correct.
Got it. Right.
Similar, but in a lesser capacity than skilled nursing facility, because obviously they don't have all the medical equipment there. But the plan is to get it up to that level.
Yeah. Yeah. And so it's not stood up yet.
No.
Okay.
There's a whole process when we've had people in it, like with decontamination and things like that. So there's a whole process. So just know that the government of Guam is working closely with these facilities to ensure that they are having a walkthrough with public health, and CDC is reviewing what their capabilities are and which ones are ideal for these kinds of locations. And it's not like we're there yet, again, because we do have the skilled nursing facility available that's not at full capacity. So therefore, we're just really preparing based on what they've seen in the community. The governor is very concerned with the numbers that we've been seeing as tests increase. So we're just really making sure that we provide all the necessary rooms available and convert those rooms to what is needed.
Are you guys getting, or the hotels, I mean, I hope this isn't a stupid question, but are they getting paid for this? Is this,
Yes, they are under contract negotiations and agreements are in place, and part of the funding is for lodging and meals is through the federal dollars. Mm-hmm. So the governor, I believe, has spoken to that before. So these are contracted services, just like just so you know, like all of the linens are outsourced. The hotels don't have linen services anymore. That went away more than 10, 15 years ago. So they've thought through all of those moving parts and have contracted with facilities. The one thing that the hotels or other types of facilities have provided as part of their contract is meals. So, because I've gotten requests from other types of businesses like restaurants in providing those meals, but it's something that the hotels or facilities are including because it's another way to help contain contact, right?
Right.
So it's important that it's all part of the same process and comes from the same source.
Right. Yeah.
And one other thing before we let you go, because I know that the hotel industry, they're experiencing a lot, but they're also giving back as well. And and I read, I get your updates that you send, and there's several different hotels, right, that have stepped up.
Oh my gosh!
Provided
I
donations.
Just gave the update, and initially GMH asked for 12,000 units of shower caps and amenities and all that. I just provided that report into GBB and through our response committee, our RAC at EOC, and we're currently calculating it because I got the update last night. But I have more than 10 hotels who have donated shower caps, amenities, but also gloves and other types of things. And so we're well above. I want to say we doubled the number of units that GMH needed. But also, it's not just to GMH. I've seen some donations go to the Mayor's Council for elderly in the community, but also the ones who have quarantine hotels have created care packages with inspiring notes for those in quarantine as well.
Send us some pictures of that stuff, Mary, if you can.
Sure. We're going to be releasing that with GHRA, and so we'll send that out to you as long as I'm just working on getting permissions for releasing that on the photo themselves. Yeah. But thank you for mentioning that, Sabrina, because I think, even though they are challenging times, I think that the industry themselves, just like other businesses, have really stepped up, but not just the hotels, but also restaurants. Restaurants have, I don't know if you saw what Lenny at Kadu recently, but there's a lot of restaurants who have stepped up and really even distributors have gone out and started donating some things. But, as much as donations are good for our community, so is the level of support back to the businesses. And so I'm really, as much as we want to mitigate like any community access and tell people to stay home. There are still delivery services available from these restaurants. So we've been trying to send out the positive messages as well. So thanks for bringing that up, Sabrina.
All right. Well, thank you, Mary. I know you're working really hard.
Man, you are a hustler.
Goodness.
Wow.
Oh, you have no idea.
We have an idea.
But there's a lot. And, that's why GHRA was created, is to serve as that intermediary liaison with government of Guam. And so I personally have been at the EOC RAC for 14 years, but GHRA has been part of that whole process. So I just want to remind everybody that, we are here for you. We're here to kind of help navigate you through this because we want businesses and employees of the industry to remain strong during this process and have a long-term plan. That's what we're working on next, is that economic measure and long-term plan.
Nice.
So that businesses don't get stuck in where we're at today.
Okay, Mary, we really appreciate it. We'll let you get back to work.
Thank you.